Well, welcome to the lunch session. I'm really looking forward to this. It's my privilege to introduce Ingrid Ulrey. Some of you would know Ingrid. She is the Director for Region 10 for the U.S. Department of Health and Services. Region 10 is responsible for 4 states, Alaska, Washington, Oregon, and Idaho, and everything that relates to health and human services in those 4 states. And Ingrid is the director. It's my privilege now and honor to introduce Ingrid to you so she can introduce our distinguished lunch speaker. Ingrid?
Thank you. Can y'all hear me okay? Excellent. It's so great to be here. It's so amazing to be in person with all of you. This conference is a special place for us. I feel like for me it's like a New Year's ritual. Very beginning of the year, the chance for a bunch of health policy nerds. You don't mind if I call you that, do you? It's our catch-up time. Sometimes it's the one time a year I see some of you. And it's important that we have a chance to connect and support each other before the busyness of January sets in. I have participated in this conference for over a decade, wearing many different hats. First with AARP. Any AARP people out there? Then with Public Health, Seattle King County. Public Health. I mean, a lot of people have worked their way through that incredible institution. And now with HHS. So our collective fight for healthcare justice is long, and it can be lonely. So it's really important that we have this time together to have this connectivity. And I'm really grateful for the people who've over the years, made this space possible. I want to call out Aaron Katz from the University of Washington, who was one of the founders of this space. And thank you to Aaron. I also, he's not here today, but he's going to be told by Molly that I did this. Thank you. I also want to call out DJ and Kariana Wilson, who really got this going. And I will admit that there was a whole span of time when I just referred to this conference as the DJ show, fondly. And now HMA. So we here in Seattle are all very grateful to you at HMA for taking the reins and continuing to make this space. So as you may have noticed, I am not HHS Secretary Xavier Becerra. I send his apologies. He was so excited to address you today, but he was called into a high-level meeting. And when you're a cabinet secretary and you get called into a high-level meeting, that just happens, as you can imagine. But I'm very grateful and graciously welcome our U.S. Department of Health and Human Services Deputy Secretary Andrea Palm. Give her a hand, and I'm going to introduce her to you. I see you. Deputy Secretary Palm, who we just call DepSec, is the Director of Day-to-Day Operations at HHS. She is known for how effectively and efficiently she literally just keeps our trains running. And that's a massive feat when you think about how massive and huge HHS is with all of its operating divisions from CDC to HRSA to CMS. It's a really big job. Prior to this role, Deputy Secretary Palm served in the state of Wisconsin as the director of the Department of Health Services. So like all of you in this room, she's been at the forefront of state-level innovation in the healthcare space. She was a member of Governor Tony Evers' cabinet, responsible for the Medicaid program, behavioral health programs, and led the state's COVID response. So truly in the trenches, as many of you have been. Previously, And this I think is probably the secret sauce that makes her so able to keep the trains running in our agency. She served for 8 years during the Obama administration within HHS, holding a number of different roles, including senior counselor to the secretary and chief of staff. Born and raised in upstate New York, and having completed her studies at Cornell University, Deputy Secretary Palm launched her career as a social worker. So Deputy Secretary Palm, thank you so much for beaming into the Emerald City. We're really excited to hear from you. Thank you.
Thank you so much. And I would echo Ingrid's regrets from Secretary Becerra. He really was looking forward to this, but as Ingrid mentioned, did get called into a cabinet meeting. So, you know what happens when the president calls. You just sort of go. So here I am, and I'm very, very glad to be with you all today. And really do want to express again my appreciation to you, Ingrid, for how ably and well you represent this administration there in Washington and in the Northwest more broadly in our Region 10. I also want to thank Health Management Associates Senior Advisor Vernon Smith for hosting this conference. I need to give a shout out to Governor Inslee for his leadership, and particularly in the space of health innovation and health equity. Director Birch for providing the morning keynote, and all of you who have been involved in the organizing and development of this conference, and for your continued efforts to fight for better health for the people of the state of Washington. We join you here on this coast to continue to do that work together. So I am, as I noted, really very happy to be with you here today. Happy to kick off 2023 with all of you, and to really recognize what you all as a state have done and have consistently done in the space of leadership or in innovation, in health innovation and health equity. And you really do serve as a model for the rest of the country. And it dates all the way back to times like 1987, when you all were really one of the first states to implement a state-subsidized health insurance program. You have extended health coverage all the way back to that moment for low-income working adults and others. You took the Medicaid expansion early after the Affordable Care Act was enacted. You all have taken the option to extend postpartum coverage for 12 months. And in 2019, we're the first state to enact a public option for health coverage. So your history speaks for itself. The work that you all continue to do in this space is really important and shows not only your commitment to being innovators and to leading the way, but to advancing health equity in all the ways that you can. And I would just say, as a former state health secretary, and Ingrid noted my original career in social work, it really is, as you all know on the front lines, critical that folks in our communities have access to health coverage and to what they need to maintain good health and wellness. And it's really why I'm happy to talk a little bit before we get to Q&A about the accomplishments that I am so proud to be a part of here as part of the Biden-Harris administration. And I'll start sort of where the administration started, which was with COVID, and really just remind everybody how far we've come in this space. We have administered hundreds of millions of vaccines for free, vaccines that we helped drive the development of and then purchased and distributed on behalf of the American people with the partnership of state and local public health, really to help save lives, reduce hospital stays and need for hospitalization and severe illness. We got kids back to school, and we really have been able to connect families again in ways that while we all were safer at home, weren't able to really do. And now we need to do the work of helping our community members stay up to date on their vaccines and continue to advance that cause moving forward. Also, in these first 2 years, I really am so very proud as somebody who was around in the Obama administration and worked on the Affordable Care Act. It is so satisfying and so meaningful for me to see how much progress we've made in access to affordable health coverage since those early days of the Obama administration, and to really note that we have more folks covered now than we have at any time in our nation's history. More than 300 million Americans have access to care, and that's a really critical foundation for the health and well-being of the people of this nation. And we're seeing again this year record numbers of enrollments. From November 1st to December 15th, nearly 11.5 million Americans signed up through healthcare.gov and our state-based marketplaces, and about 1.8 million more people, or 18% more than what we saw last year at this time. It's a all-time record, and again a really important milestone for us as we continue to think about affordability and ensuring as many folks as we can. And I think I also really would like to highlight the equity piece here, if I could, for a moment. Last year, we saw a 50% increase in enrollment among Black and Latino community members. And I really think it's an important part of the way we think about health in the Biden-Harris administration, with an eye towards underserved communities and ensuring that we meet people where they are and that they have the same access to coverage that other communities do. In the same space, this administration has really focused on behavioral health. It is the priority of this administration that we treat behavioral health the same as we treat healthcare more broadly, that this sort of historical divide of the neck up and the neck down really, we really need to get to a place where that's not how we think about behavioral health, but that it is truly integrated into the healthcare system, and that there is no wrong door to accessing behavioral health. And so in this space, we have a couple of important milestones. Again, places where we have worked with our state partners to advance these goals. We stood up the 988 Suicide and Crisis Lifeline. It's, a first in the nation 3-digit number. Previously, as you all know, it was a 10-digit number, and this transition has really allowed us, with significant increased funding, to build out the crisis network that has existed in a more of a patchwork to get us to a place where we were able to serve about 350,000 people versus about 264,000 at the same time last year. With the 10-digit number. So we will continue to invest in our lifeline, as well as in other parts of the crisis continuum and other parts of the behavioral health system as we work to integrate it into healthcare moving forward. I'd be remiss if I didn't note the Inflation Reduction Act, which I think we will spend a little bit more time on during Q&A, but I would highlight that starting this month, savings for those with Medicare will kick in. That insulin prescriptions will be capped at $35 a month, and recommended vaccinations will be free. It also kicks off our run towards Medicare's ability to negotiate drug prices, and we're looking forward to continuing our implementation work in that space, because these are really life-changing, life-saving improvements in the Medicare program and to our healthcare system more broadly that we're anxious to continue to make progress on. So, just in closing, I would again say what a privilege it is to be a part of an administration that really has put health equity, health innovation, access to healthcare, and behavioral health improvements at the center of the way we're thinking about the work that we do. And while we recognize we have considerably more work to do, we're anxious to do all that work in partnership with you all, and really do look forward to continuing to make progress in these and a whole variety of other areas. So again, I really want to express my appreciation to you all for having me here today, for the work that you do on the front lines, for your community members in the state of Washington. And I think, Ingrid, my job is to turn it back over to you, I think.
Yeah, I'm actually carrying you across the stage right now. Yeah. We're learning how to work in this virtual weird world. Deputy Secretary, thank you so much for your remarks and for being with us today. We have arranged in advance about 6 questions here from members of the audience. And just for the folks asking the question, just want to remind you to please remember to share your name and your affiliation with the Deputy Secretary, and then we'll take it from there. So I first want to call on Michelle McDaniel.
Hi, good afternoon, Secretary. Deputy Secretary, again, Michelle McDaniel. I'm the CEO of a behavioral health organization called Crisis Connections. Among the services we provide, we are the 988 provider for the King County region. And so I first want to thank you and the administration for all the support around that in behavioral health. We were quite honored to have Secretary Becerra come and visit us last year on the mental health tour, and heard a lot, certainly during that visit, around the commitment to supporting behavioral health. So of course my question is going to be around that now that we're into 2023. What are some specific areas of partnership that the federal government will be working with communities like ours to further the behavioral health reform and expansion?
Mm-hmm. Appreciate the question, and I would note, maybe just as a personal point of privilege, my very first job out of graduate school was as a crisis counselor. So I have worked the hotlines, and to see the progress being made now is just so important. And I think whether it's the crisis continuum more broadly, beyond just the hotline, or as we think about behavioral health integration and work that we need to do in the behavioral health space, I think we here at HHS are approaching this as a really whole of department effort. How do we think about the levers that we have and how they work together to improve behavioral health care, and how it interfaces and is integrated into the healthcare system? And I think that is an opportunity that I feel particularly responsible as a member of the leadership team at HHS, to make sure that we are doing that work deliberately and diligently, and really breaking down those silos and making those connections across the department, so that we are meeting states and local providers and communities where they are, with opportunities that allow us all to meet the needs of the people that we serve. But I think it is important, as you noted, that the investments, the 20-fold investment that this administration, with the help of Congress, has made in the Lifeline is really important. But if we don't work the rest of the pieces, we will not have done what we need to do to really get to a place where people have access to the behavioral health that they need. And so we continue to press on all of these levers. The ability for states to use Medicaid and other federal programs to support the Lifeline and its operations. We are using money from the American Rescue Plan, we got a provision in the American Rescue Plan that allows states to do a mobile crisis plan amendment through the Medicaid program, right? That's another opportunity to bring additional funding to the table in the mobile crisis space. Our Bipartisan Safer Communities Act had provisions to expand certified community behavioral health clinic programs nationwide, as well as allowing some expansion, again, in this mobile crisis and stabilization space. Particularly with some grant and Medicaid money. The omnibus bill that just passed had more than $500 million to continue support for the Lifeline and for behavioral health crisis services. It also had improvements to mobile crisis in the Medicare program. So we again are pushing on all levers in this space to bring to bear resources that states and communities can leverage to continue to do the work that we need to do, that stems from expansion of the Lifeline, but also so that once we connect people to services, those services exist, and that there is a network at the state and local level to provide what our community members tell us that they need. So this is a space where there's lots more work to do, where we are very committed to that work. This administration has made it a priority. There is a real interest, a bipartisan interest in Congress, and so we will continue to push on all the levers that we have to make real progress in this space.
Deputy Secretary, thank you so much. And thank you, Michelle, for the question. And I also, Deputy Secretary, want you to know that we have a member of the Jamestown Squalum tribe here, Vicki Lowe, who has been a champion, along with others in this room, of Native and Strong, which is the first in the nation tribal 988 line. Thank you. For our next question, I want to call on Dr. Shah.
Good afternoon, Deputy Secretary. I want to first introduce myself, Dr. Umair Shah, Secretary of Health for the great state of Washington, and I do want to tell you that this is a fantastic state, so we are glad you can join us virtually. I know Secretary Becerra has been here a number of times, and it's just always great to see you and your team, and if you could also just well wish Secretary Becerra and your team in the other Washington. I'd like to say thank you for that. The question I have is really maybe a twofold question. One is around where we are today. Obviously, COVID-19, respiratory season. We're seeing an incredible health surge in our state and across the country. I just wanted to maybe have you reflect on what you see now that we're into the new year with 2023, on what the challenges are with applying that COVID-19 lens to currently the system and the situation that we're in. And then maybe a broader question that's long-term about what are the long-term outlook for applying many of these very lessons for transforming emergency preparedness, both in public health and healthcare, for the future. And the last thing I would just say is that we've had such a strong partnership with the administration, and Governor Inslee and his team, our team, just really are appreciative of everything you all have done to help support the state of Washington and Washingtonians. So thank you for that partnership and leadership, and just look forward to your comments. Thank you.
Thank you. And I would just reciprocate our appreciation for your partnership in this space and in others, and for your leadership as the Secretary of Health, from one Secretary of Health to another. So I would say a couple of things. I sort of noted in my comments that there's more work to be done in the vaccination space. The staying up to date on vaccines and ensuring that as many folks choose to get vaccinated as possible is continues to be a very important goal. We launched a six-week sort of sprint campaign in mid-November to really try to double down on our efforts as an administration to increase vaccination rates, particularly among older individuals and folks in nursing homes, recognizing that that is the place where severe illness and death is still most common. And so that is a place where we can save lives in a really meaningful way. And so I would say to you and to others there that continuing to emphasize and to do the hard work of increasing our vaccination rates among our senior citizens, folks in nursing homes, those who are more vulnerable to severe illness is a really important piece of work that we need to continue to do. The fact that only about 16 million seniors so far have received the updated bivalent vaccine is a challenge to all of us to continue to do this work moving forward. I think the other piece of that really is how we think about things like test to treat, right? The access to Paxlovid, to that antiviral quickly after diagnosis of COVID is an important countermeasure, an important intervention to ensure that we reduce illness, severe illness for those who are infected. So sort of the 1-2 of increased vaccination and increasing access and uptake of Pax are important tools that we have, right? Tools that we didn't have at the beginning of this pandemic that now can help us reduce severe illness and death, and are places where we all can and should be doubling our efforts in those areas. I think more broadly, one of the things that for me is such a privilege about working at HHS is the broad scope of our preparedness, responsibility, and capacity, right? We really are at HHS an end-to-end enterprise. We have the NIH assets that are doing the very early research and clinical work around potential vaccines and countermeasures and what is long COVID, and all of those very early basic research questions are places where our NIH part of HHS are really important. And that pulls through the rest of the HHS family, right? We have ASPR and our BARDA assets that take potentially successful vaccine candidates, medical countermeasure candidates, and help pull them through the system in a way that they're the more advanced trials and clinical work that needs to be done beyond what NIH is in NIH's purview is a really important part of how we help bring to market potentially important countermeasures in the pandemic and other disease space. FDA obviously has a critical role in approving safe and effective countermeasures and have done that work very effectively through this pandemic. And then, of course, our CDC and local public health folks who are helping us understand diseases as they emerge through their surveillance work. And then on the back end are really helping us look at the effectiveness and safety of vaccines once they are broadly and countermeasures once they're broadly being used in the population, and right then the cycle starts all over again. But these are all assets we have within the U.S. Department of Health and Human Services, and it is our responsibility when we think about preparedness moving forward, how those pieces fit together, the ways in which the pandemic stressed those pieces, the ways in which we need to bolster their legislative, their statutory authorities to do the work that needs to be done, and really allow us to continue to be good partners to you and to other states, whether it's in other pieces of business we have to do with COVID, whether it's monkeypox, whether it's our fellow countries around the globe who are dealing maybe with Ebola or with other infectious diseases where our expertise and the improvements and the work that we will continue to do to be as well positioned as we can to protect the American people moving forward happens. And so it's a really exciting opportunity and moment for us as we look at the wide array of preparedness that we think about and bring that to bear on legislative discussions moving forward. I think I would be remiss if I didn't also talk about the behavioral health aspects of this, as well as the human services. I think, as a state health secretary, one of the main lessons we learned on the ground was that the healthcare system and the human services supports food security, housing, the whole variety of things that wrap around this pandemic, that there weren't always muscle among and between those various systems, and how we think about bringing to bear the human services pieces of resilience and access to benefits or other support, community supports those are really important lessons and ways in which we can do better for the people that we serve moving forward. And then, of course, the behavioral health pieces of this are, sort of without saying that we have all seen the consequences to our collective behavioral health from this pandemic, and how we think about our preparedness from that perspective moving forward is another really important piece where HHS has, again, within our enterprise, levers and opportunities to bring to bear and to break down silos and to do good work to help us make sure that we are more and better prepared in the future, just based on what we have learned here in the last several years.
Deputy Secretary, thank you so much. We are running out of time. I'm going to try to squeeze in just 2 last questions. So the next is going to be a face, well, I'm sorry you can't see his face, but I'm looking at it. He's a blast from your past, Anthony Woods.
How you doing, Deputy Secretary? Anthony Woods, President and CEO of Amerigroup, Elvin's Health Company. You and I had the opportunity to work together in Wisconsin with Governor Evers as I was a CEO for the Blue Cross Blue Shield plan there. Great work. Glad to see you. And, to cut to the chase, with the COVID pandemic, not going away, but uncovering much of what we already knew about health and health disparities in all of the communities across Washington and across the country. Together we have to do a lot, in order to make things happen. But when you think about, and you touched a little bit about health equity earlier on, when you think about the work that needs to be done around health equity, could you talk about some of the work from a federal level that you expect to do and be very intentional about around health equity?
Appreciate the question, and good to see you as well. So I think that one of the things that this secretary and this president have been very clear across the administration is that equity is a thing that needs to get baked into the way we do business, so that we're not sort of retrofitting it on what we're doing, but that we're considering it on the front end. And so for us here at HHS, that manifests itself in some obvious ways, but in less obvious ways, like how we think about data collection, or how we think about our grants processes. Right, there are foundational equity issues in access to federal dollars that the way you do grants can help facilitate or can be a barrier to. And so we are taking a very soup to nuts look at the way we think about equity and making sure that we are taking that lens to all of the work that we do. I think more foundationally, in our programs, we are thinking about things like the public health unwinding and how we need to make sure that underserved communities are not disproportionately impacted by the potential to lose access to Medicaid as those redeterminations are starting to happen beginning April 1st. And so, we're doing it in very programmatic ways. We're doing it in operational ways. And we will continue to think about the ways that we can work with our state and local partners as well as Congress to make sure that we are structurally and foundationally thinking about equity in all that we do.
Thank you, Deputy Secretary. And the final question is going to come from AARP. There she is, and a mic is coming to you, Marguerite. Right here. State of Reform staff. Here you go.
Thank you. Hi, Deputy Secretary. I'm Marguerite Rowe. I'm the Washington State Director for AARP. We represent over nearly 900,000 members here in Washington. By 2050, 23% of our state's population will be 65 and older. So this is a growing population that we care deeply about. Two priorities for our Washington State members and residents have been preserving and strengthening Medicare, and of course, with that includes lowering drug prices. We were thrilled to be part of the fight in passing the Inflation Reduction Act, and so I'm wondering what HHS will be doing to ensure that providers and individuals are all aware of the new benefits that are part of the Inflation Reduction Act, and wondering about the implementation process and how stakeholders like taxpayers and Medicare beneficiaries will be involved.
Thank you for that question. And I would just note how long AARP has been in the fight on drug price negotiation. I was a lowly Hill staffer back when we enacted the Medicare prescription drug benefit, and you all were advocating for drug price negotiation back then. So an important contribution to lowering drug prices for seniors, and much appreciation for that. I think we are very focused on implementation swiftly and efficiently and transparently, to your point about how do people know what the new benefits are, when they're coming, and how to access them. And so I think just a couple of reminders, because benefits are certainly already starting to roll out. As I noted, this month the cost of insulin prescriptions capped at $35 for people in Medicare, and I think it's important to note, and sort of astonishing to think about the fact that if we'd had this in place in 2020, 1.5 million Medicare enrollees would have saved well over $700 million. So the impact of these provisions is significant to the pocketbooks of seniors all across this country. And also starting this month, we talked a little bit about preventive vaccines. I think it's, again, important to think about this from a really concrete perspective. The shingles vaccine can run you a couple $100. That is one that is now included for Medicare beneficiaries for free. So significant cost savings for seniors already starting to roll out. But obviously the drug price negotiation provision, which is a really important provision of this law, and one that we are very excited about, is a new book of business for HHS, and we are staffing up. We need to bring new expertise into the HHS family to help us build this program and to execute against implementation. But you will start to see in the very near future additional information about the timeline and actual concrete implementation steps. I would say we have a September deadline, which we certainly will meet, in which we will talk about the first 10 drugs that will be on the table for drug price negotiation, and then the timeline will move from there. So really significant, really important pieces of the puzzle starting to come into view here in the next several months. And I think it's really important to note, as you did, Marguerite, that stakeholder engagement, transparency around these provisions, ensuring that people understand the timelines, how they can provide input to the development of this program, and then how we communicate the actual benefits upon decisions, for example, about the first 10 drugs, et cetera, are really critical pieces of how we together make sure that people understand the benefits of the Inflation Reduction Act, and particularly some of these really important Medicare drug cost reduction provisions. So we look forward to continuing these conversations, to engaging with you and other stakeholders as we move this forward.
Thank you, Deputy Secretary. I know your staff has told me you're running the clock right now. Any final word for your audience?
They say that, but it's not really true. I just, again, would really just want to express my appreciation for you all having me, especially since you were expecting somebody above my pay grade. I appreciate your willingness to hear from me instead. Look forward to continuing to work with you all as we improve the health and well-being of the people of this country that we all have the privilege of serving. And again, thanks to you, Ingrid, for your work out there in the Northwest, and appreciate your time today.
Thank you. Thank you, everyone. And you're always welcome. Come visit.